April 24th through 28th is Every Kid Healthy Week, a time dedicated to activism for children's wellness and combating obesity. The Centers for Disease Control and Prevention report that 12.7 million children in the United States are obese. The highest population is Hispanic children at 22%, followed by African Americans at 19.5%, Caucasians at 15%, and lastly, Asians at 9%. The prevalence of obesity among 2 to 5-year-olds is reported at 9%, with 6 to 11-year-olds at 17.5% and 20.5% of those that are 12 to 19 years old. Every Kid Healthy Week's mission is to counteract this trend with nutrition and physical activity plans to keep kids active and optimally nourished. But maintaining children's health goes beyond diet and exercise. Regular checkups with a doctor are also vital. The specialists of Lake, Ear, Nose, Throat, and Facial Plastic Surgery explain their strategy for treating their pediatric patients.
My approach to treating children is to treat the person, like they are a big person, and actually talking to the child, letting them know that there's nothing scary. And of course, we don't give any injections to kids here, so that's their first question is, are they going to get a shot? And we always say no. But just letting them feel welcome and comfortable. I hardly ever wear a white coat because that really scares them, Sometimes even just giving them a pair of gloves makes them feel very calm and relaxed.
The pediatric side of the practice really is one of the things that attracted me to ear, nose, and throat at the beginning of training. I enjoy the wide range of age groups. Kids are fun to be around. The kinds of things that we treat in pediatric ear, nose, and throat, tonsil disease, ear disease, sinus and allergy type problems that we see, it's very gratifying because you can really help these kids feel better, help them hear better, and improve their quality of life.
Things kids put in their ears or in the nose. A lot of things actually. I've had a Trident wrapper up the nose. I've had a pea up the nose. Lots of beads in the ears, Play-Doh, anything you can imagine. Lots of beads though in the ears. They want to find out what's going to happen if they do something, and usually more often than not it can't come out by itself, so we have to help them.
Some of the difficult things in diagnosing and treating a child is they don't necessarily tell you what's bothering them. So you have to be a problem solver. You have to kind of dig under the surface and ask questions to the parents and try to get the information from them to try to make the diagnosis. And from an examination standpoint, sometimes they're little wiggle worms. They don't really hold still too often, but most of the time they're pretty cooperative.
More often than not, when I see a child with something in their nose, either they told the teacher, they've told a pediatrician or their parents that they stuck something in their ear or nose, and we'll either get a call, or if they've gone to the emergency room and they weren't able to get it out, due to our specialized tools, we have a better capability of getting those things out and easier, not so traumatic to the child. So half the time they'll admit to what they did, other times it won't be till we get the item out, and then they'll kind of fess up or say a brother or sister did it.
Well, the most common problems are problems that have been around for the past 20 years, tonsil disease and ear disease. And the kids are still developing chronic tonsillitis. But one of the more interesting areas of pediatric ear, nose, and throat now has to do with not necessarily the infectious aspects of tonsil disease, but the obstructive aspects of tonsil disease. We're seeing a lot of kids who are being diagnosed with ADHD, ADD, who have a condition called obstructive sleep apnea, where they're just not sleeping well at night. And that translates into difficulty during the day with school, with frustration levels, with behavioral problems, and bottom line is these kids just don't sleep well at night. So we're seeing a real rise of doing surgery on tonsils and adenoids for obstructive problems because of snoring and sleep apnea. And these kids really, it's not a far cry to tell the parents that you can have a new kid on your hands if we take the tonsils and adenoids out, because they're going to be able to breathe better and sleep better at night.
For more information on this story, as well as links to the specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Pediatric Patient Story Link icon on our homepage, yourhometownhealth.com.